Welcome back. What's up, y'all? It's Lauren. I have another unpopular opinion to share with you. I'm realizing more and more that I have many unpopular opinions, thoughts, or working hypotheses that might not resonate well with a lot of people, but I'm going to share them anyway because I have a perspective backed by experience and expertise. So I'm going to go ahead and share it. When it comes to maternal health and the maternal health crisis, first and foremost, let's acknowledge we are dealing with a maternal health crisis. We are dealing with a maternal health crisis in my country, in America, and in a lot of other countries. And the trajectory, I'm not even going to just say trajectory, but the velocity, right? The speed and the direction that we're going isn't necessarily favorable on a lot of fronts. There are folks that make their living literally talking about the issue, raising awareness about issues affecting maternal health. There are a lot of folks out there that have absolutely no idea that we're in a maternal health crisis, which is wild to me. When you're in certain environments, you might not be exposed to or be aware of the outcomes that other people have from your perspective. It's real and I get it. This video isn't about raising awareness. It's not about screaming about systemic racism. It's not about injustice and policies that need to move. It's about something a lot more nuanced than that. And I think it's underneath a lot of that. Let me start off by sharing an experience that a lot of you probably have had, or at least heard about. And that is the experience of being on time to class and having to hear multiple times from multiple teachers about the importance of being on time to class, the importance of being on time to school. I get so many reminders in the mail. The district is pushing attendance and they're like, yeah, if you consistently miss the first 10 minutes of class, then by the end of the year, you've missed X amount of days of school and instruction, and that's what leads to X, Y, and Z. But a lot of times, the audience to that complaint is full of folks who are on time to school consistently. And so the message doesn't necessarily reach the ears of the folks who would benefit from hearing that message. You get me? So we're in a bit of a conundrum here. So yes, continue to raise awareness and whatnot. That's great. But dare I say it, I think that we have some levers to pull. The impression that I keep getting in a lot of these rooms where we're talking about systemic racism, systemic oppression, and the systemic reasons behind social determinants of health, between disparities. A lot of what I'm hearing is we have to aggressively attack those things. We need to raise awareness and aggressively attack all of that stuff that's going on, which kind of makes sense. But I dare say it leaves us an opportunity to go even further. It gives us an opportunity that is not being addressed at our disposal, that we can move on now and not have to wait till later. A scenario that I like to give is from one of my favorite books. Ironically enough, it's called Great at Work. I'm not an employee anymore, but it's called Great at Work. And there's this scenario where the author was taking us through a metaphor of a levee or a dam breaking. And the dam breaks, and downstream you have folks drowning. Their houses are being enveloped by water, and the flood, just more and more people further and further away from the break in the levee or the dam are in danger, and they're flailing, and people are actually dying and drowning. And what the author was saying is, that a lot of great leaders get stuck in trying to do everything, right? A lot of these great leaders will look at the folks drowning and go, I need to help them, which is true. I need to help them. But guess what? People are going to continue to drown, unfortunately. People are going to continue to die and be put into danger and reap the consequences of this dam being busted. So what leaders do is they look at each other a lot of times, and I've been in these rooms, kind of judge each other because I think the solution is to fix that dam or to recreate that dam or to build a better solution for that dam, right? While other leaders might think the solution is to go and rescue those people that are in acute distress right now at this very second. They're both leaders, both are needed. You need to shore up the dam and you need to rescue the people and prevent them from perishing. But a lot of times we look at it and point fingers and go, you're not a leader unless you're a first responder, boots on the ground, saving those people who are drowning. You're not solving the problem. You're not contributing to the solution if you're not physically building that new dam or shoring up the dam to make sure that more water isn't coming out and drowning people. It's sad because now we're in the year 2025 and it is possible to do both with technology. And that gets really exciting. It's possible to build for both the system itself that needs to be repaired or replaced and to save those downstream who are in acute distress. And in order to do that, I think it's important for us to reevaluate our focus and reevaluate what we consider dependent when it comes to progress. Because a lot of times folks give me the impression that some of the folks that are working on the dam over here, and I'm working on the dam too, by the way, are just like, this dam has to be fixed this way or else nothing else matters. Like no other work. This has to be done first and foremost. So what ends up happening is, as a collective whole, we end up, and again, this is just an unpopular opinion, right? I'm not trying to be on a high horse here, but what I'm trying to say is, I don't think that we have to solve and cure social determinants of health, that we have to solve and cure systemic racism, that we have to solve and cure whatever the valid concern is in order for folks to be better off. Because we are in a crisis right now. It's maternal health crisis, not just state of maternal health. So in any situation, especially if you're in crisis, it's very important. And I have done crisis response with crisis response, survival and whatnot. And it's important for you to be able to take stock of the current situation as it is, right? Noting the situation, the resources that you have at your disposal, noting the low-hanging fruit, noting the triggers or the levers at your disposal to pull to move forward. When it comes to health equity and addressing health disparities, a lot of times we turn first and foremost, and actually I'm going to keep it maternal health. First and foremost, we look to the birth workers because the birth workers have unprecedented access to patients, and it is because they have built trust with the patients that is oftentimes outside of the system or the systems that there are, right? Yeah, I feel like birth workers, and let me define birth workers here because I have a weird definition of birth workers that might not be compatible with some others. When I say birth workers, I'm referring to those boots on the ground, providers that might have their own businesses, that care for pregnant, postpartum folks. This might be your doula, your lactation consultant. This might be your community health worker. This might be your mental health professional. And when I say mental health professional in here, because you're like, what? Mental health professional is a birth worker? You gotta be kidding me. No, I'm not saying that the mental health professional has to only care for maternal health patients, but there's definitely a place for them in the maternal health space, last time I checked, right? Deaths by despair, hello. But we have to acknowledge that unique subset of their population that they care for as well. Let me share a little bit about my insights of what these beloved, incredible, valuable birth workers bring to the table. Besides the trust of the clients, they have the trust of the patients, the trust of the moms. Obviously, and we know that is why we champion it and we talk about, yeah, birth workers, woo, yeah, they're the answers to the problem. They're the answer to the situation that we're in. I do believe that as well. One of the answers, which is great. But let's think about the lot of the birth worker. What kind of tools do they have at their disposal? Because I feel like we get to the point where we treat birth workers as our silver bullet, but we also scapegoat our birth workers too. The birth workers are going out and saving all of those folks from drowning downstream, but they're saving all those folks drowning downstream with what resources? Do the birth workers have boats like the ones up here? Do the birth workers have flotation devices? Do they have flashlights? And that in this metaphor translates to, do they have scheduling software? Do they have a CRM? Do they have an electronic health record, or are they just dealing with paper and spreadsheets? Is their electronic health record interoperable? Meaning, are they able to connect with and collaborate with other members of the care team? Or are they left to their own devices like a lone wolf? We're just like, yeah, woo, yay, yay, you're the answer to our problems. And then just hear the resources that you have. And I think that it does a lot of disservice there, because what would happen if birth workers were equipped with the same resources, the same quality of resources that other members of the care team take for granted? What if we sent birth workers out into the community with the technology and support they need? Awesome. Let's take it a step further. What if the birth workers had a seat at the table, at least even feedback loops, right? Because a lot of times what I'm finding, and this is not just me being haughty, but I talk with birth workers every single day, like specifically doulas. And these birth workers are having to cobble together their tech stack. And I'm like, this is like for their operations and also their tech stack that they use to actually care for patients, care for clients, care for people. Not only are they having to cobble it together, but all of those building blocks they're using are not built specifically for them. That can get really difficult. And if they are built for them, like electronic health records, they might not have the features or the capabilities, the quality capabilities. I dare to question, I dare to ask, if these folks had enterprise-grade tools at their disposal, responsibly made, with them having a seat at the table, with the education rooted in their feedback and their validation, I find it very difficult to fathom that being a bad thing or leading to bad outcomes. What would happen with our morbidity and mortality rates if these folks had the right tools for them? And then on top of that, let's take it a step further. We talk about evidence-based practice and whatnot, which is great. I love evidence-based practice, but we got to think about it, right? Evidence-based practice is practice based off of evidence. What is evidence? Evidence is data. The foundation of all of that is data. You base your practice off of evidence. What if birth workers had the capability of producing evidence of the effectiveness of certain interventions as well? What if it was possible for that level of information to be available to birth workers and for them to be armed with that evidence when we iterate on the tools and the capabilities facing community health workers, doulas, lactation consultants, mental health professionals, anyone that serves maternal health patients. Then you get to the point where you're able to have experts, the same experts that we were like, here, we have a problem. Now the birth worker, the community health worker, the lactation consultant, whomever is able to produce evidence. Evidence of best practices, evidence of what works, evidence of what worked for that particular demographic, that community, for combating that specific social driver or social determinant of health. These are all things that keep me up at night. Now, I'm at the point right now where I have so many hypotheses that I'm working on in my head. And as I share them with the community, they come up with these really cool hypotheses too. And I'm just like, what if we were able to test these hypotheses? The time is now to form hypotheses, to consider what has not been done before, to take all the awareness that has been raised, internalize it, and form goals, form plans, and move forward accordingly. Because I think that is how we will be able to heal systems or build new systems, better systems that actually serve those that we're trying to reach while supporting those who are providing the care. So yeah, a little bit of an unpopular opinion I wanted to share with you guys today. If you are a birth worker, this is me extending an invitation to you. If you are an independent birth worker and you have hypotheses, I want to hear from you. I want to hear what your thoughts are, what your feelings are on my unpopular opinion. I also want to know more about your tech stack. What does your tech stack look like? I think by sharing things like that in the comments, it opens that up for others to see and understand what your reality actually looks like. I would love to take some of these conversations from the DMs into the open, because I think that's where the collaboration and their synergy happens.
Look out for new updates.